Well, good morning, everyone. I am Brett Anderson, the President and CEO of Ebenezer Senior Living, and it is our absolute honor today to host Governor Walz, Representative Morrison, and this panel to discuss a very critical and important topic around Medicaid. If this is your first time on the Martin Luther campus, we started in 1961 by an area council of Lutheran churches, and today the campus includes the Martin Luther Care Center, which serves 128 residents, Meadowwoods, our assisted living and memory care community that serves 106, and 2 adult day programs. In total, 85% of the people served by this campus rely on Medicaid. And while we're on the campus of an older adult community, we know Medicaid doesn't just touch older adults. It touches everyone, and it touches us all, from children to working adults to older adults. And that's why it's vital that all of us stay engaged in this very important topic. And with that, I'll turn it to the governor.
Well, good morning, everyone. Brett, thank you. The folks at Ebenezer and here at Martin Luther, grateful this beautiful facility and the folks who work here caring for our loved ones. To each of you, thank you for taking the time to come today. And the purpose of these and this panel group you see along with Representative Morrison, we've been trying to do these informational panels around the state so that people understand. Because one of the things, if you hear about cuts being made, there's 2 sides to that ledger. What happens with those cuts and what are the actual impact of those cuts? If you're hearing about a cut and it saves money and it doesn't impact people negatively, people are very supportive of that. But if you're talking about cuts that have an impact on human beings, quality of life, all of those things, then we need to think those things through. And there's a reason that it goes through a process. And the Congresswoman being Article 1 of the Constitution, it's the Congress that allocates the money. It's the Congress that makes the laws. And I know this having been a member of Congress, but also now on the executive side, our job is to carry them out, not to make the laws, not to interpret the laws, but to carry out as they were written. And Medicaid is very clear in the impact that it makes. So I think what you're going to hear from Director Connolly, you're going to hear from experts, but most importantly, you're going to hear from folks who have personal experience with this. And our goal is to inform Minnesotans about what the proposed cuts, what they're talking about, and what life will look like if those cuts go through. So I'm grateful you'd all come spend some time. I'm also grateful that Minnesota, in a long tradition of doing this, sent an incredible legislator to Washington, sent someone that I had the privilege of working with in the Minnesota legislature, who I said, I can speak with some authority on this. I know what it looks like when you're doing the job of a member of Congress, and that's doing the work. It's meeting with your constituents, and it's helping to inform before you take some of the votes or the impact. And with that, I give you Representative Morrison.
Thank you so much, Governor. Thank you. Thank you. Good morning, everyone. I just want to share a few brief remarks, and then I'm looking forward to hearing from everyone else, and then we'll have a conversation. I want to thank Ebenezer for hosting us and for the important work that they do, and of course to Governor Walz for bringing us together this morning. And thanks to all of our state leaders, our nonprofit leaders, our healthcare workers, and some of our local neighbors who get their health coverage through Medicaid for joining us this morning. Thanks for doing the hard work you're doing of showing up and speaking out and sharing your story. It's not easy to do, but it's so important, so I'm really grateful. Thanks for advocating not only for yourselves, but for your neighbors, your loved ones, our communities, for the people you've never met and never will meet, to ensure that they're able to get the health care that they need. And that's really what's at stake here. The Republican proposal to gut Medicaid will not only be devastating to the 1.4 million Minnesotans who get their health care coverage through Medicaid, it will be devastating to all Minnesotans. And I think that's really important to emphasize today. It will impact everyone, regardless of whether you get your health care through Medicaid or not. It will be devastating to our local hospitals, our healthcare system, and our state budget. I am here today not only as the Congresswoman for the Minnesota's 3rd District, but also as a physician, a doctor who has had the honor and privilege of caring for Minnesotans for more than 20 years as an OBGYN. And as a doctor, I will tell you what the Republican majority in Congress is doing with their budget, literally selling out the health care of tens of millions of Americans in order to pay for tax cuts for the wealthiest among us, is simply unconscionable. Over the last few weeks, they have been pushing their budget through Congress, and while they've been doing that, I've been meeting with dozens of Minnesotans across the 3rd District and visiting with hospitals and clinics. And I will tell you, they are literally all terrified about what these proposed cuts to Medicaid will mean. Not only will it mean that services and coverage are being cut for individuals, it will mean that entire hospitals may shut down. I'm really disappointed that the latest update I have to share from Washington, D.C. is that just last Thursday, the Republicans were able to pass that budget through the House on a party line vote. That budget included the framework to cut Medicaid by at least $880 billion. Before we voted on the bill last week, I went to the floor of the House to read the letter that more than a dozen Republican state legislators here in Minnesota wrote to our Republican members of Congress and to President Trump, imploring them to not make these cuts to Medicaid, warning them of the devastating impact and the dangerous threat their budget poses to Medicaid, to the state budget, and to Minnesotans. The Republican lawmakers, my former colleagues in the state legislature, called the Republican budget unworkable, unmanageable, said it would devastate services and would put incredible pressure on the state budget. And I think that the governor would agree with that. So my message to my Republican colleagues who control the majority of both chambers in the House and the Senate is this. Your own party is raising the alarm not to do this. Minnesotans do not want you to rip away their health care coverage. Minnesotans do not want you to shut down our hospitals and clinics. Minnesotans do not want you to decimate our state budget. And they really don't want you to do it to pay for tax cuts for the wealthiest among us. And here's the thing, this should not be a partisan issue. Healthcare is not a partisan issue. We all need it. No matter where you live, who you vote for, everybody needs access to health care and open, functioning hospitals. But I will tell you, while this budget did pass, the framework for this budget did pass last week, this fight is not over. These cuts have not yet become law, and we're going to fight this every single step of the way. And that's why I'm so glad to be here this morning with all of you, to hear your stories, to highlight the critical importance of Medicaid, to take your stories back with me to Congress so that the Republican majority hears loud and clear that they cannot gut our health care to pay for tax cuts. So with that, I will pause and pass the microphone, I think, to John. Back to Jeremy. Thank you.
Thank you, Governor, and thank you, Representative Morrison, for those remarks. And yeah, want to thank Martin Luther again for hosting us today. As the Governor alluded to, this is the 6th in a series of statewide roundtables that we've been doing around the state to inform Minnesotans about the impact of these potential federal cuts to healthcare and Medicaid in particular. We're going to focus on Medicaid together, but I think we'd be remiss if we didn't just point out that this is not happening in a vacuum. It's not just Medicaid, but there are other reductions in key healthcare spending happening already and kind of on the chopping block coming forward. One is the $225 million that was taken away from the Department of Health for critical public health needs. There was another $27.5 million that was taken away from the Department of Human Services for substance use and mental health services. The current administration also just put forward a market affordability rule, which has other changes to the individual market that will make insurance less affordable and less accessible to folks. And then there's a looming expiration of the enhanced advanced premium tax credits, which will make buying insurance on the MNsure market much more expensive for middle-class Minnesotans everywhere. So I think it's just important, while we're focusing on Medicaid, which is certainly the big topic in the room, it's not just Medicaid that we need to keep our eye on, but there's other things happening that could impact Minnesotans across the state. We have a great panel today. I want to pass it now to our state Medicaid director, John Connolly. He's going to talk at a high level about the impacts about the Medicaid program and what the proposed federal changes could mean to the state budget. And then we're going to have Dr. DeRoche speak as a physician. And then we've got a great panel of individuals who have direct experience with Medicaid who can talk about how that makes a difference in their lives. And so with that, I'm going to pass it over to you, John.
Thank you, Governor Walz, Representative Morrison. Appreciate you being here with us today. Good morning, everyone. I'm John Connolly, Deputy Commissioner and State Medicaid Director at the Minnesota Department of Human Services. Hosting these Medicaid roundtables provides a valuable opportunity for all of us to come together to talk about the impact of Medicaid on our lives, our communities, and of course our healthcare system here in Minnesota. To my fellow panelists, your presence and expertise are invaluable. Thanks for joining us today and making the time. And today's conversation is critical as we face a period of significant change and uncertainty, both at the federal level and here within our state. At the Department of Human Services, I want to share that we are diligently monitoring the evolving environment and its impact, ensuring we can continue to provide our enrollees with the services that are essential to them that they rely on. We're navigating potential shifts, working diligently to minimize disruptions, continuing to improve our work and our efficiencies, and maintain our unwavering commitment to serving our communities effectively. A significant aspect of the changing landscape, of course, and the primary reason for our focused discussion today is the profound uncertainty regarding potential federal health care cuts, as we've heard this morning. The proposed $880 billion target is not just an abstract figure. It represents a direct threat to the health and well-being of countless Minnesotans and the stability of our healthcare system. This significant number underscores the potential harm to our state and the truly challenging choices that we will have to make if these cuts are enacted, primarily targeting the Medicaid program known here in Minnesota as medical assistance. Medicaid is the very foundation of healthcare for over 1.2 million Minnesotans, more than Medicare, more than any single commercial insurer. It's a lifeline covering everything from life-saving treatments to preventive care to half of all long-term care costs in this state. And Medicaid has a huge role in the health and development of children, covering everything from prenatal care to births to preventive screenings for just under 600,000 Minnesota kids. And importantly, children who have access to Medicaid have better health in adulthood, greater attendance in school, lower high school dropout rates, increased college attendance, and pay more in taxes as adults compared to adults who lacked health insurance as children. Unfortunately, there's no way to sugarcoat the consequences of these potential cuts. They are dire. Many Minnesotans would lose their health coverage entirely, jeopardizing their access to vital medical care, and this lack of comprehensive coverage leads to skip preventive care, resulting in worse health outcomes for them, but also higher costs down the line for all of us. We would see a rise in uninsured individuals, forcing more of our friends, family, and neighbors into damaging medical debt, and forcing impossible choices between their health care and basic necessities. And even for those remaining on Medicaid, significant service cuts would be unavoidable, severely limiting coverage and forcing vulnerable groups, especially older adults and people with disabilities who account for a large share of Medicaid spending in Minnesota, to make heartbreaking decisions about their care and limiting their long-term care choices. These cuts would also deeply impact, of course, our healthcare providers, with rural hospitals and long-term care facilities already facing financial strain, bearing the brunt of these cuts. Medicaid dollars are a lifeline for these providers, and its erosion would destabilize our entire healthcare infrastructure. It's important to note that Medicaid has been built over 60 years, 6 decades of careful work and incremental progress, and I'm hoping that Medicaid will give us the strong foundation to help us navigate the days ahead together. So I appreciate the opportunity to be here today. Forward to the conversation.
Thank you, John. Good morning. Thank you for the opportunity to be here. I'm Kim DeRoche. I am a family physician, and I lead and work in primary care at mHealth Fairview. I care for patients across the lifespan, from newborns to seniors, and I see every day how essential Medicaid is to their health, their independence, and their dignity. Last week, this campus itself hosted its first intergenerational day, bringing together preschoolers and older adults and residents here together with music, art, and most importantly, connection. And it highlights the fact that Medicaid itself is intergenerational. It supports seniors, yes, but also, as we've pointed out, children, working parents, people with disabilities, and pregnant moms. It's a common thread that helps families stay healthy and stay whole. At mHealth Fairview, Medicaid covers roughly 1 in 5 patients. These patients do span the spectrum. They're working adults who manage chronic conditions while holding down jobs or caring for aging parents. They're babies who need a healthy start and new parents who count on coverage to make it through those critical early months. They're aging Minnesotans with diabetes or heart disease or memory loss, people who need consistent team-based care, including regular monitoring, access to medications, and access to mental health care before a crisis, not after. For all of them, Medicaid means being able to take care of themselves and also being able to stay employed, to care for the people they love, and to live with dignity, whether they're able to be independent or if they need support every step along the way. When Medicaid is threatened, the consequences are immediate and they are deeply personal. Patients end up skipping appointments, they go without medications, they can become socially isolated, and they ultimately may end up in the ER or hospitalized, sometimes for conditions that were entirely preventable. This financial toll can be enormous, and the human cost is even higher. As outcomes get worse, people and families can be left overwhelmed. Medicaid isn't just a health insurance program, it's the foundation for healthy families and thriving communities. From our NICU babies at Southdale to our residents here in Bloomington, Medicaid is what gives people at every age the stability they need to stay healthy, to care for their families, and to live with dignity. Without it, we will all feel the impact.
We'll hear from some of our panelists directly impacted and the people that they work with now.
Good morning. My name is Darren Kovar. I am a parent partner on the Youth Care Transitions team with Nexus Family Healing. We provide intensive wraparound services for families with a child discharging from residential treatment or after boarding an emergency department. I came to this role as a parent of 4 that has personal experience on how completely overwhelming it can be to get a child in crisis the help they need. There is no roadmap or manual for navigating these situations. It all feels impossible. Even if you have the privilege of education or wealth, a child in mental health crisis is far too much to bear for any family. What is clear is that access to care is foundational. When our children are in crisis, Medicaid is the unsung hero delivering a lifeline to effective treatment that can make all the difference. As one example, in 2022, 60% of youth with a mental health diagnosis received care covered by Medicaid. Medicaid is the primary payer for children's intensive mental health care. Reliance on Medicaid extends throughout our full behavioral health system, covering over 20% of Minnesota's continuum of behavioral health needs. Most families we work with would not be able to get the services they need without Medicaid, also called medical assistance here in Minnesota. In fact, families knowing MA has them covered is often that one thing that allows the relief and space for families to lean in where they need to. I have watched a young man step up as a caregiver of his younger brother after discharging from the ER after a suicide attempt, get him into therapy, back to school, and back into the community. Adoptive parents finally getting a diagnosis and understanding of the child they lovingly brought into their home, parents working through their own trauma as their child is treated in a residential facility. None of this could happen without Medicaid. Mental health needs don't exist in a silo. If a child doesn't get the help they need, the impact is a ripple effect that reaches far and wide and at a much higher cost. Court appearances, job loss, calls from creditors, threats of eviction or rejection from family all add to the struggle of parenting, striving to help their child to get needed treatment. Threats to Medicaid adds to the stress, instability, and fear for our families. Importantly, just as Medicaid is the unsung hero of children's mental health care, Medicaid is foundational for our entire behavioral health service system. With Medicaid, we have opportunity to access life-saving care. It is truly unthinkable how a decrease in Medicaid would devastate the limited capacity we currently have to meet the needs of all Minnesotans. I can attest personally to the life-saving value of Medicaid. We are building the mental health system that all Minnesotans need to save lives and live well together in community. Thank you.
Thanks, Darren. My name is Linda Fess. I am from St. Paul, and I feel very strongly about this issue. I am on Medicaid because I, during my doctorate, was doing fine, and at the end of my study started to feel a little ill, and found myself done with my doctoral studies, very sick, very poor, and without any insurance, and unable to afford the $900 a month for COBRA benefits. Excuse me. So luckily, I had a friend who worked at DHS, and she brought me the combined application, which is the application for Medicaid and other benefits. And I was able to get, this was 10 years ago, I was able to get health care that day and use it that day. And eventually, very soon afterwards, my doctors found out that I had a congenital heart defect. And my life was saved because I had access to health care. Otherwise, I wonder if I would have thought, you know, maybe this is just a cold, and I would have kept going and going, and something drastic could have happened. So this is a strong, I feel very strongly about this. Everyone needs access to health care. This is a right. Speaking of, I think I need an eye exam because I can't see this very well. But so I don't have to worry about seeking help when I need surgery, which I've needed a few since then, or treatments to save my life. I've been very sick. I've been close to death a few times, but I don't have to worry about needing special imaging for of my heart, and I was able to get that correct diagnosis. My body was being destroyed, and here I am. I'm thriving now. I didn't have to pay for any of that. I couldn't pay for any of that, so I'm beyond grateful for these interventions that Medicaid has brought me, and it's not just health care. I was introduced to the Coordinated Care Center at Hennepin County Medical Center, where they have a multidisciplinary approach to medicine as complex medical needs. They provide therapy, they provide dental care. In one clinic, you can get everything done you need almost, and that's such a great clinic model, and it's all Medicaid based. For someone who has trouble with mobility or mental illness, if it's difficult to get around, you don't want to leave. So that model was perfect for me, and I thought, wow, they're treating me like a VIP. But then I noticed they treat everyone like that. So Hennepin County has been wonderful to me, the Coordinated Care Center. I have felt completely supported with Medicaid. And when patients are unable to pay for insurance, Medicaid covers these life-saving access to care that none of us can live without. I'm concerned about not having coverage and how this would affect my health. How would anyone live without care, without health, without coverage, without access to doctors and clinics, and with the emergency, with the ER being your primary source of health care? That's not an effective way to seek care. You can't get maintenance care that way. You can't get dental care that way. You can't see an eye doctor at the emergency room. you need primary care. So right now, I can focus on my wellness. I can not worry about how I'm going to pay for care and what treatment I have to skip because I have to eat instead, or because I need to pay for something else instead. I can just focus on being well and and contributing to society in other ways and being a productive human and feeling good. So Medicaid affects us all, even the people who don't use Medicaid, because we all need to be healthy to have a better society. So I hope you all got something out of what I had to say today and support us in support Medicaid. Thank you. Here's Patrick.
Yeah. Thank you, Linda. But I asked you not to do such a good job.
Oh, come on.
That was wonderful. Medicaid is absolutely crucial for providing affordable health insurance to millions of Americans, especially seniors and those with disabilities. Access to affordable health care and preventing financial hardship are both essential so that health care costs, especially as health care costs increase, really all the costs of living in America or Minnesota are going up. The idea of taking funding away at this time, it seems crazy to me. So I spent decades as a school social worker, so I certainly saw how Medicaid and medical assistance was there for many of the students, but especially students of low income. They need to be healthy too, to learn. And a big part of my work was helping link people to those services. So, but later in life, because I'm retired a couple of years, now I'm working with a much older voluntarily, but I have a very good friend who lives here. He's upstairs. So Ted is a Vietnam vet. He spent years in the Brown Water Navy fighting for America. He was Agent Oranged repeatedly. He never got the kinds of illnesses that the VA was able to give him extra funds for, although the VA has done a nice job of helping with some of his other health needs over time. But what he did get is he got a prostate that just grew and grew and grew. Instead of prostate cancer, he had this huge prostate. So I've taken him to many exams. They eventually reduced his prostate, and thankfully he's doing better. But an enlarged prostate for this vet, also a clinical social worker like me, he and I go way back. And persistent urinary infections that have nearly killed him on a couple of occasions. And because he didn't have a lot of family support here in Minnesota. He has what we call Team Ted. And he has been able to survive and then thrive. And if you were to visit with him today, he would be express his gratitude for how this agency and the services he's getting, he still wants to live. We still sort of argue about his end-of-life plan because he's willing to take all, he says, I want to live, right? And as a vet and a man who gave his life to helping underserved guys in prison, he was part of Minnesota's system to help these guys get back on their feet and find the right path, and I think he was very successful with hundreds of people. So, if he lost his care here, where would he go? Would he become homeless again? We got to fight for this. Enough said.
Thank you, brother. Thank you all. Well, to Darren, Patrick, and Linda, thank you for sharing your stories, but thank you for trusting us with those stories. Also, I congratulate whoever has Johnny Cash's 1963 Ring of Fire. That is gold. So if you're going to have a ringtone, that is the one. So, well, look, and just the note we're here, we're going to have pass it along and be able to ask a few more questions, but the purpose is to try and humanize exactly what's going here. And I'm going to go with what Director Connolly said. This program is 6 decades of expertise, data, and outcomes that have proven effective. Now, if the issue here is inefficiency, then talk about the inefficiencies and show us where that is. An arbitrary number that you're going to cut with people who were not elected, because let's all be very clear, the Constitution is absolutely clear. Appropriations start in the House of Representatives and only in the House of Representatives, and decisions made about funding government programs come from that. We're dealing with a situation where not experts. We've got a couple here. We've got Representative Elkins and Coulter. We have Senator Mann, Dr. Mann, subject matter experts who work on this every day. They put things together. They debate them. We vote on them, and then we implement them. This process now has arbitrarily decided that someone decides that these programs they don't like and they arbitrarily cut. We cannot allow them to make that decision. They need to look into the eyes of the gentleman sitting upstairs and what it means to him, or the families that are being cut, and tell us how this is going to make America better, how it's going to make us healthier, how it's going to make us stronger, how is it going to save us money? Because I guarantee you, it is much cheaper to treat these things on the front end than to deal with it on the back end. It is much cheaper to get someone housed than to deal with a situation where they are homeless in the long run. Unless we have decided that we have no moral responsibility to our neighbors or to make the system work. And so I think it's really important, and I'll turn it to Representative Morrison. But the questions I'm asking, and I often ask when I ask people in government, what happens if something is gone? Because there's always the assumption that there's an upside if these decisions are made. We're going to save money. And I wouldn't hold your breath that you're going to see any of that money, even if they save $880 billion, because Representative Morrison's been very clear. That's already tagged for other people in forms of a $1.5 trillion tax cut. If you fall into that tax bracket that's going to get one of those, good for you. Most of us do not. And the impact is going to be dramatic because it's not going to be a choice. That gentleman is moving out of this facility and finding someplace else. Linda is not going to get that, and she is going to slip back into the situation you're at. And the families that you heard talked about are going to suffer that. So I'm going to turn it to Representative. Then I'm going to let you. We'll start us out. Ask a few questions of our panel, and you've got experts here on how it impacts the state. It's about. It's significant. It's about $1.5 billion a year, and it's about 250,000 Minnesotans out of 5.8 million that will be instantly impacted and go to zero. The state has no capacity to make up that difference. We will do our best, but we don't have the capacity. And I will say this, we pay more to the federal government. Those are our tax dollars that they're stealing. They deserve to come back to Minnesota to care for our people. If they want to do this, I would entertain, let's just not pay the federal government our share of the federal taxes if they're not going to give us anything back for it. And I trust our legislators to do something with it. So with that.
Thank you, Governor. And you referenced several things that reflect the moment that we're living in our country. It's an incredibly perilous moment. Today we're focused on healthcare, Medicaid specifically, and then some of the other things that John referenced. But I want to thank you three for sharing your stories. It's so hard to do it, period, for many of us, but especially publicly in front of a group and in front of cameras. But it's incredibly meaningful and it's incredibly powerful. So thank you so much for being willing to. I'm thinking about you three and the people in your lives. I'm thinking about all the babies that I delivered over the years. One of the bills I'm most proud of that we passed with help from these people over there was extending Medicaid to 12 months postpartum. Yeah, it felt very un-Minnesotan to me that we would kick new moms off their health insurance 2 months after they had a baby. We have unacceptable racial disparities in maternal and infant morbidity and mortality in Minnesota. We have a substance use and mental health crisis. New moms and their babies need to have access to basic health care so that they can get off to the best possible start. I love how you referenced this is an intergenerational program because it impacts all of us at different stages in our lives. and the ripple effects that you all referenced. When one person, when one of us is struggling mightily, think about all of the different people that impact. It ripples through a community. Everyone's lives mattered. And you, Linda, talking about you felt like you were being treated like a VIP. You know what? Everyone deserves to be treated like a VIP, as you should have been treated like a VIP. We all deserve that. I'm thinking about my new friend Bob, who I met the last time I was here, who I hope you won't mind, sir, if I share your age with everyone. But he, Marine Reserve veteran, 85 years old, very funny, also kind of a flirt. But he said, you know what? The reason I'm here today is because of Medicaid. And I feel so strongly about this that I'm willing to go march and demonstrate and do whatever I can so that other people can have access to Medicaid. And I admire that so much. But, sir, you should not have to be marching in the streets at age 85 to protect Medicaid for the rest of us. So I want to thank you. I want to thank Ebenezer again for inviting all of us, the governor, you all particularly. And then I'll pass it on unless you want me to toss a question out, Jeremy.
I'm curious on this one is, state of Minnesota, we administer these and our county partners help us on this. What does it look like? How does somebody out there that's struggling with this, how do they enter the system? And what are these state employees doing to help them? You heard Linda talk about this of someone getting them in, because again, it's always easy to throw the state employees or the federal employees under the bus and call them bureaucrats or deep state or whatever. They're your neighbors that help you get these things that you've earned or deserve to have. I'm kind of curious. Maybe hear the director.
Yeah, so I think there's tremendous work happening every single day, both at the state level, but also at the county level and our tribes here in Minnesota, working very hard to make sure that people have access to the services that they need in a timely fashion. And I think what's really scary at this moment is that if the cuts of this magnitude actually come to pass, if they are included in a budget reconciliation package, and we see, roughly $1.5 billion cut from our Medicaid program, we would just have impossible choices to make with respect to the benefits that we cover in the program that, as we've heard, are essential to kids, to people with disabilities, older adults, people with mental illness and substance use disorders who really rely on Medicaid and the benefits it provides, in addition to potentially, reducing eligibility, who qualifies for the program and can enroll based on their characteristics, and then, of course, the payments that we can offer to providers. But those things are all parts of what we and our partners and tribes and counties do every single day to make sure that, again, folks have access to the program, can enroll, have access to their benefits, and that providers get the payments they need to provide essential services.
And I would just add, as we've gone around the state, and we've been in Duluth, we've been in Moorhead, we've been in Rochester, we've been in Mankato, and we've had county workers with us at some of these panels really talking about what the local impacts are. And our county workers, and one of the things about Medicaid, it is a partnership between the federal government, the state government, and our county partners. And our county partners are the ones who are on the front lines really doing a lot of the service delivery, and they talk in these roundtables about what it means for them in terms of not being able to deliver key services to people with disabilities, not be able to help families who may be on the cusp of food insecurity or other issues, keep their children out of the child protection system, which then leads to all these worse outcomes down the road. And they talk really articulately about all the ways in which Medicaid really infuses throughout their communities, and also how Medicaid helps their employers. Hospitals are oftentimes in rural areas the largest employer, and without Medicaid, many of those hospitals would not be able to keep their doors open, and that just creates more unemployment, which creates more need at the same time that we're taking away from the program. So it's a really important question, and Medicaid, it's a really, I think, important example of the way that Medicaid really just infuses all throughout our communities.
Thank you for that explainer on Medicaid, because I think it's important. I think, we call it medical assistance in Minnesota, so I think sometimes there's confusion. Those are the same thing. Medical assistance is Medicaid in Minnesota. And I think, I think it's the numbers, 55% of Americans get their health insurance through their employer. So I think some people think, well, that's too bad about Medicaid, but that's not my problem because I get my insurance through my job. This will impact all of us. So we all need to be awake and paying attention to what's going on, because this will hurt everyone. It will not just hurt the most vulnerable among us, though it will. It will hurt all of us, because if you don't have a clinic to go to, if you don't have a hospital to go to, if you get into a car accident or have a heart attack, it doesn't matter if you got health insurance through your employer, it's going to impact you too. And the governor and I were just talking about actually how low the reimbursement is for Medicaid. Medicaid is already a very lean program. In fact, I'm sure some of our healthcare administrators and executives would share that we've made it increasingly difficult to take care of Medicaid patients because the reimbursement is so low. And I want to emphasize again that it's not just, I love that word intergenerational, it's not just the working poor who benefit from Medicaid. It covers all parts of our society from the beginning of life until our natural death. So this is something that we all have to be awake to and paying attention to and advocating for. And I'm really grateful to my former Republican colleagues for being willing to buck their party in this moment. I think it's incredibly important. We need more people to be brave. We were talking about earlier how we each have to be a little brave right now in this moment. You guys are being a lot brave today, but we need to stand up to this and say, this is not what we want. So please, Republican majorities in the House and Senate, stand up to the president and stop this. Yeah.
And talking about, it's hard to talk about this in a vacuum of what's going on. And Patrick, I was reminded by this of, he's talking about his friend, the veteran. Keep in mind, this same thing is happening to the Veterans Administration. 83,000 people are being cut from that. You mentioned the Agent Orange, something that I worked with, and the representative helped pass a very significant piece of legislation, PAC Act, and implement it. There's cuts to the PAC Act that are coming with that. Pile that on to the families that are talking about these children. They are gutting the supplemental nutrition program, the SNAP program, and the summer EBT program that adds food. Here in Minnesota, we feed our children breakfast and lunch at school, but when they go home for the summer on holidays, they don't have it. So think about the issue of their health care in general, the services they're getting. Compound that now that you're taking away the services that provide food or housing, or the special impacts that happens with veterans who have that care that can only be delivered at the VA. And we do it in partnership. So these types of things that were thought about for decades and stacked on together, I think it's really important. They have been very clear about this. There's been no report written on this. There's been no data. These are unelected officials, some of them 20, 21 years old, that decided they were going to cut these programs. I agree that you shouldn't have to be out in the streets, but I'm also going to encourage you to do it because, damn it, this is wrong. This is wrong the way it's going. You can talk about efficiencies, but no one has yet shown me. And again, I tell you this, Medicare and Medicaid and these programs have about a 2 or 3% overhead. Nobody in the private sector is able to deliver it at that amount. They deliver it with that efficiency. Can we do better? Sure. Sure, we should continue to do better. But when did we throw out 95% good to try and fix 5% that's not? And we're falling into this trap. And I think it's really important, again, for folks to ask their neighbors and understand this. And the one with senior care, those of us who have parents that are getting to that age, if you think we're in a crisis now for senior living, especially in rural Minnesota, cut Medicaid and find out what happens. Where are they going to go? Where are they going to go? So.
And before I give it back to you, Jeremy, while the two of us rant about this, I do want to bring us back because I think that we have to remember we don't need to be having this conversation. The reason we're doing this is so that they can pay for tax cuts for the wealthiest among us. That's why we're doing it. It's not about efficiency. This budget explodes the national debt. It's not about cutting the debt. It is about paying for tax cuts. That's why we're having this conversation. You know, I prided myself on my bipartisan work when I was in the state legislature. I'm a lifelong Democrat, but I grew up in a Republican family. I love Republicans. I love it's in my DNA. But we're living in a different moment right now. The reason we're having this conversation is to pay for tax cuts for wealthy people. It's wrong.
Sure, and I think now we've got time to take some questions from the press. And so if there are questions for any of the panelists or Representative Morrison or the governor, we're happy to take those.
That comes from my conversations with leadership in some of our local hospitals, that they do not see how they can do the math to keep their doors open. And I'm talking about our major trauma centers. Imagine our world without HCMC or North Memorial and Robbinsdale. What will happen? What will become of us? It's that dire.
I would echo, and it's a good question on this, Jeremy. I would say those are threats even without them doing this, that the situation is that dire as it is. They're not crying wolf. It's going to happen. And I asked Minnesotans and the panel, they gave you a good indication of what would happen. If you're going to make these types of decisions, you have to picture what's it look like afterwards. And what you're talking about is something that we fought for decades not to have. The poverty in the streets, that our seniors not getting the care they need, the homelessness that goes on top of it, hunger. And it's all, again, I want to congratulate this of refocusing us. This is all unnecessary. And again, it's a bait and switch on efficiency. It's a bait and a switch on we've got fraud, waste, and abuse. Certainly we can always work on those things. But the portion of these really great programs and to totally throw them out, and I'm just going to name this, there is no one that's doing this that has any expertise whatsoever. They have no damn idea what they're doing. They don't listen to people who know. I don't know this like a doctor knows it. I don't know it like someone who's experienced these programs as much, or the experts who do it. But if you're an elected official, you have a responsibility to learn it, to use the data, and then talk about it how it really matters. So it's pretty catastrophic. And I am in absolute agreement of this, of the way they talk to us. We are already in crisis in our healthcare system. If this what underpins so much of it. And if you, again, the crisis in the long-term care and in senior living, it would blow the bottom out of it. And I can't imagine we're a state that provides more, does more. There's got to be states that rank on the bottom of this that I don't know what they're going to do. Yep. Yeah. Yeah, and it's a great question on this. Something we've done, and we've specifically focused on the grants that are starting to impact. You heard a little bit about that affecting what. Look, we've seen a reduction in overdose deaths, and I'm going to thank Jeremy Drucker for working this, that we elevated that to cabinet level position and the resources necessary. Those are all going to be underpinned. So we have a dashboard, if you don't go, the Minnesota Management and Budget, that shows each day what's happening with our cuts, because we wake up in the morning administering programs that have been around for decades, and we receive a note that says this program is gone, lay off everyone. I don't know what business operates that way. Bankrupt businesses, bad business people do this. That's what's going on, but that's what we're dealing with. The question that's being asked is this fundamental, the funding we get that is guaranteed to us through Medicare, through Medicaid, Title I for our schools and things like that. We're starting to now try and understand what that is, but I hope everybody understands there is no way the state of Minnesota in any way can come close to backfilling what's lost. And we're starting to plan, and I've told us we're preparing for the worst case scenario, but it's almost impossible to, if they go through with this and it's $1.5 billion, you heard it from Director Connolly, this is not cutting fat. This is cutting bones, breaking them, and tearing everything out. There's basically nothing left of the programs to be able to administer. And I think that's what we're looking at. Yeah, and I know at this point in time we never talk about that in a normal year. We got to get our work done by the 19th of May. But I've been saying this: we have to adjust to the changing situation that's federally. These legislators are doing an incredible job working in the constraints of dealing with a normal situation. And unlike the federal government, the state government has to have a balanced budget. And in Minnesota, we take it a step further. We try and balance for 4 years out. Which makes good sense. I think Tom's question is a good one. I would certainly say we have to be open for anything, because if these cuts do happen after we come up with a budget, after we close out on May 19th, and we see the catastrophic cuts across the board in all these programs, I think we have to be prepared that may be a possibility. But again, it's going to be very difficult if these things happen. There's not a whole lot the state is going to be able to do to backfill on them, but how we adjust. And I think you heard Director Connolly talk about this. One of the things is, do you start changing eligibility? Do you start cutting people off? And to try and keep what you have alive pretty much destroys the program. Not far. But that would be something that I think we would have to think about. The legislature will decide that, as the appropriators do. Again, the state of Minnesota has our maximum amount of rainy day funds, neighborhood of $4 billion. We also will have a surplus at the end of this when we get done, depending on where we land, between $2 and $3 billion. So the state would be sitting on about $7 billion, but the cuts that are being proposed would eat that up. And then we have the ongoing cost into the future that what do you do then? That would all be one-time spending. These will be permanent cuts forever. So the 10-year proposal is $14 billion that will come out of this, is what we would have to try and budget for. We can't even come close. But these are things that we have to think about. The legislature will determine that, working with us, what they feel constitutes an emergency on rainy day funds. But I think it'd be very difficult to make that case. And let's, I think the good news maybe in Minnesota is you do have Republican legislators who understand how bad this is, and we may be able to get their help. Yeah, well, what we're doing is slowing growth. Keep in mind, we increase spending by 2% every year, and we're basing it on our federal share that's coming into this. We're taking the case on this is certainly that we can look at efficiencies, and I would argue what we're doing in Minnesota is having an honest conversation, looking at the numbers. The state of Minnesota spends more per capita than any other state on disability waivers. I would argue it's because we're a caring state, but also the numbers that we spend are significantly in real dollars, like not per capita wise, in real dollars, it's California, New York, and Minnesota. We're the 19th largest state in population, but we've had the three. So what I'm proposing is, and what the conversation we're having is, can we still spend the most of any state, which we would significantly, but cut it from a 13% increase to a 2% to stay equal with inflation? And that's what we're talking about. If the federal government were having that conversation, I think Representative Morrison would be listening to them, would be saying, is there something we can do? They're not making that case. Yeah, I'm going to hand it down to these folks. Yeah, it's a great question.
Thank you, Governor. So I think the question's an important one, and really there are three major levers that we'd have to explore. One is, again, cutting eligibility, or who qualifies for the program based on household characteristics, income, people with disabilities, and older adults. And so thinking through where we would have to pull back in that regard. The second is really with respect to provider payment. And of course, we already heard that our provider payments are fairly lean in Minnesota and in most states in Medicaid. So Medicaid pays a lower rate relative to Medicare or commercial insurers. And so that's already a tough ask, I think, for providers and for the state with respect to finding savings if we lose $1.5 billion a year. And then the third, of course, is looking at the benefits and services that are covered in the program. So which of the really important services we've heard about today would we have to look at for reductions? And those are really impossible, unbearable choices that are being forced on us to be able to fit into a $1.5 billion or $1.6 billion cut, according to some estimates, in Medicaid funding from the federal government out of $10 billion annually. So that is a significant cut, given that we have a structural imbalance we're already working to address right now without that cut. So it would just put us in a really difficult position. And as the governor said, we just couldn't absorb that without reconsidering some of the things that I mentioned.
It's impossible, because that's out of the Energy and Commerce Committee's budget, and you cannot make $880 billion of cuts out of the what that committee has jurisdiction over without gutting Medicaid. The math just doesn't math.
Yeah, well, we have looked at that. We do have the office space and have the ability. I understand that there's disruptions for folks, but the ability to come back to work in there together, the 50% of the time is right in line with the vast majority of every other state government and most of our private employers. And so I understand this. I value our state workforce greatly. In the midst of all of this discussion we're having, what I'm asking folks is to come back and work with their teams 2 days a week, to be able to use that space, to be able to collaborate together, understanding that you've got to make some changes. We all did during COVID, but I feel very strongly about that. And then the cuts that are being made, we're continuing, and I want to thank of course, our federal partners who are helping us, but I want to thank the Attorney General. We're winning these lawsuits of pushing back because this is unconstitutional. They're wrong. It's illegal. We're pushing back, trying to protect those jobs that we have, and we're trying to get more clarity on that. We have temporary restraining orders that are in place right now, but that's very disruptive to folks. So I'd just like to say I understand the great stress that's going through our state workforce. It's, in this case, we're protecting our workforce. We're hiring. We're getting them contracts. We increased pay by 10% in the last biennium that we worked with them on that. And that is in stark contrast to the federal government laying off workers, firing them arbitrarily. So the state of Minnesota will still work with them. I look forward to having that conversation because the state workforce is the ones that deliver these types of programs. Yeah, we're planning, and all the plans have been laid into place. And as he said, each of these agencies will work individually. We understand people have individual issues that come up. They work with their management on that to make it work. And like I said, it's in alignment with where most, if not all, states are at, and where most private employers are at. And I believe in state government now, especially the threats that we're seeing, having folks together, having them deliver the services also insulates from these specious attacks that these are just bureaucrats not doing anything. They certainly are. Yeah. Well, I think this will be a big piece of it, that we have to work together with our partners. I think the state of Minnesota is still in a solid spot, but I don't think any of us should kid ourselves. We are in very precarious territory. We've decided to pick trade wars with our allies. We've isolated and turned allies against us. We've forced many folks into the Chinese sphere of influence on a broader scale, and states are under threat for programs just like this. So I think to try and articulate, we've got some real decisions to make. And I would argue that there's a lot of folks today not certain they signed up to kick a veteran off their health care, not certain they decided to gut long-term care, not certain that this is what they were told. They were told they were going to save money. Heck, they were told they were going to get a check. You're not going to get a check. Representative Morrison's been very clear about this. The only people getting checks on this are the wealthy. That is simply the way this is laid out. The rest of us are going to deal with what's the chaos. So yeah, I think I'll lay that out, but I'm also going to focus back that there's many, many things to be optimistic about. And I am going to seize upon this issue that we do have Republican legislators who put themselves out there in a letter to President Trump and a letter to the Congress to not do these cuts for these very reasons. They are being totally honest about it. They understand the issue, and they're trying to find a solution. I think there's a glimmer of hope there that we can come together, and I think that's what that speech will look like. Thanks, folks.